Have you ever brushed off a little dizziness, a strange pain, or that feeling of being more tired than usual, just because you thought, oh, it's just part of getting older? If you've done that, even once, you're not alone. In fact, most people over 60 do it more often than they realize. But here's the hard truth. Sometimes, what seems like a small, harmless symptom is your body's way of sending an urgent message. A message that says, hey, pay attention, something's not right. And ignoring these messages? It could cost you more than just a restless night or an uncomfortable day. It could cost you your independence, your quality of life, or even your life itself. I know this isn't easy to hear. Nobody wants to sit down and think, what if this ache means something serious? It's scary, but pretending it's nothing, that's even scarier in the long run. If this is your first time here, welcome to Marcus Smart Channel. This is a space created especially for people like you, people over 60 who want to live longer, feel better, and stay informed about their health and happiness. Every week, we talk about real issues that matter at this stage of life, whether it's food, sleep, mental well-being, relationships, or warning signs like the ones we're covering today. So if you find these conversations helpful, make sure to hit that subscribe button and turn on the notification bell so you never miss a new video. Now, back to why we're here today. Today, we're going to talk about some of the most common, yet most ignored symptoms in seniors. Things many people over 60 overlook until it's too late. But let me be clear right from the start. This isn't about making you paranoid. It's not about turning every little ache into a disaster in your mind. It's about being informed, being aware, and knowing when it's time to take action. Because when you know what to watch for, you can catch things early. And when you catch things early, you give yourself the best chance at staying healthy, active, and in control of your own life. So let me ask you something. Have you ever felt a sudden shortness of breath, even when you're just sitting down or doing something simple like folding laundry? You weren't running. You weren't climbing stairs. You were just still, but your chest tightened. You had to stop and catch your breath. That, my friend, is not just getting older. That could be a warning sign of heart problems, or even early signs of congestive heart failure, especially if it keeps happening, or if it comes with swelling in your feet or ankles. And I know what some of you might be thinking right now, but I've been tired before. I've felt out of breath before. I'm fine. I don't want to bother my doctor over nothing. Trust me, doctors would rather see you for something small and catch it early than see you when it's already serious. Now, have you ever had chest discomfort, not full-on pain, but maybe a strange pressure? Like someone sitting on your chest? Or a burning feeling that almost feels like indigestion, but it won't quite go away? That's another big one people overlook, especially because heart attacks in seniors don't always feel like the dramatic chest-clutching scenes you see in movies. For many people over 60, heart attack symptoms are mild, vague, or feel like heartburn. You might even feel it in your jaw, your back, or your left arm, or just feel unusually weak and sweaty for no reason. If that ever happens, call for help. Don't wait to see if it goes away. And here's another one a lot of people ignore: sudden confusion or trouble speaking. Let's say one morning you wake up and your words come out jumbled. Or you're trying to say something simple like "I want coffee," but the words won't come. Or maybe you're talking to a friend on the phone and they suddenly say, "You're not making sense. Are you okay?" That's not just being forgetful. That could be a mini stroke or what doctors call a TIA, transient ischemic attack. A TIA is like your brain's warning shot. It's saying, something's wrong with your blood flow. Fix this now or next time. It could be worse. And here's the thing with TIAs, sometimes they last only a few minutes. And when they pass, people feel normal again. That's when most people ignore it. But ignoring it means risking a full-blown stroke later. I remember talking to a man named Robert. He's 72 now. A few years ago, he had an episode where, for about 5 minutes, he couldn't get his words out right. His wife wanted to call 911. But Robert, being stubborn, sighed no. "I'll be fine," he said. "It's just stress." A week later, he had a major stroke that affected his right side and his speech for months. He told me later, if I could go back to that day, I'd call for help in a heartbeat. And that's why we're having this conversation now. I don't want you or anyone watching to have those kinds of regrets. Let's talk about another one. Sudden, unexplained weight loss. If you've been trying to lose a few pounds and making changes to your diet, that's one thing. But if you're losing weight without trying, dropping 5, 10, or more pounds in a short time, that's a big red flag dot. It could be your thyroid. It could be digestive issues. It could even be something more serious, like cancer. And look, I'm not saying this to scare you. I'm saying it because catching things early gives you options. Treatments. Hope. One woman I know, Elaine, she's 68, started losing weight without trying. She kept saying, "Oh, I must be lucky for once." But after a month, she went in for a checkup, and they caught colon cancer early. She had surgery, and now she's healthy, active, and walking her dog every morning like nothing happened. That's the power of paying attention to your body. Before we move on, let me pause and ask you, when was the last time you noticed a nest day? New symptom, but talked yourself out of seeing a doctor? Be honest with yourself. This is not about guilt or blame. It's about awareness, and about giving yourself permission to care for yourself as much as you care for others. Because I know many of you watching this are the type who puts everyone else first. Your kids, your grandkids, your partner, your friends. But your health matters too. You matter, all right? We've talked about shortness of breath, chest discomfort, sudden confusion, and unexpected weight loss. But there are still more warning signs that seniors often overlook. Let's keep going. Now that we've talked about some of the more obvious warning signs like shortness of breath, chest discomfort, confusion, and unexplained weight loss, let's shift to some of the less obvious, but equally important, signals your body might be sending. Let me ask you, have you ever noticed swelling in your legs, ankles, or feet? Maybe you thought it was just because you sat too long, or maybe because of the weather. But here's something many people don't realize. Persistent swelling in your lower body, especially when it doesn't go away after a night's rest, could be a sign of something much more serious. It might mean your heart isn't pumping blood the way it should. It could also be a sign of kidney issues. I know it's easy to brush off. I once spoke to a woman named Carol, she's 74 now, who wore compression socks for months, thinking it was just poor circulation from sitting too long. But when her doctor finally checked her, it turned out she was in the early stages of heart failure. The good news? Because she caught it in time, her doctors helped her manage it with medication and lifestyle changes. Today, she's back to gardening and going on walks with her neighbors. So, if you notice your shoes feeling tighter than usual, or if your legs leave an indentation when you press on them with your finger, it's time to get checked. Another symptom I want to talk about is sudden vision changes. Let's say you're reading the newspaper or watching TV, and suddenly things get blurry in one eye. Or you notice dark spots, flashes of light, or even a sudden loss of part of your vision, like someone pulled a curtain across half your sight. Don't wait. Don't assume it'll clear up on its own. Sudden vision problems can be a warning sign of a stroke or a detached retina, or even a blockage in the blood vessels that feed your eyes. And here's the scary part. With eye issues, the longer you wait, the lower your chances of recovery. Every hour matters. I remember my neighbor George. He's 69, woke up one morning with blurry vision in his left eye. He thought maybe he just slept wrong, or his glasses needed cleaning. By the time he finally went to the A 2 days later, doctors told him he had a retinal artery occlusion, and they couldn't restore his vision in that eye. So please, if something changes suddenly with your sight, get help right away. Now let's talk about another common symptom seniors often ignore: persistent fatigue. Yes, we all slow down a bit as we get older. That's normal. But if you find yourself feeling exhausted all the time, even after a good night's sleep, or struggling just to do simple things like walking to the mailbox or making breakfast, that's not just getting older. Constant fatigue could mean anemia, heart problems, thyroid issues, or even depression. I once had a viewer named Linda write in to this channel. She said, "Marcus, I thought I was just being lazy. I'd sleep 9 hours and still need a nap by noon." After seeing her doctor, they found out her iron levels were dangerously low. With some treatment and dietary changes, she felt like herself again within weeks. So if you've been telling yourself, "I'm just tired because I'm old," pause for a moment. Listen to your body. Maybe it's trying to tell you something. Speaking of things we often ignore, let's talk about pain that lingers for no clear reason. It could be in your back, your chest, your stomach, anywhere. Maybe it's dull and nagging, or sharp and sudden. Here's the thing. As we age, it's easy to blame everything on arthritis, old injuries, or just the wear and tear of life. But new or worsening pain, especially when it shows up suddenly, doesn't go away, or feels different than what you felt before, should never be ignored. One man who watches this channel, his name is Joe, told me his story recently. Joe started having mild stomach pain, something he described as just a little cramping. He ignored it for months. When it finally got so bad he couldn't eat, he went to the doctor. It turned out to be a blockage in his intestines that needed emergency surgery. And here's another thing many people overlook: unexplained bruising. If you start noticing bruises popping up in odd places, or you bruise much more easily than before, it might be time for a blood test. Changes in how your blood clots or problems with your platelets can show up this way. One of our viewers, Mary, 66 years old, noticed bruises on her arms and legs, but shrugged it off. When she finally mentioned it at a checkup, they found her platelet count was dangerously low. She got treatment in time, but it was a wake-up call for her. Lastly, let's talk about mood changes. If you or someone close to you suddenly starts acting differently, becoming unusually irritable, sad, withdrawn, or confused, don't chalk it up to just a bad mood. Sudden mood swings or depression in older adults can be a sign of infections, like urinary tract infections, which often present differently in seniors, medication side effects, or even early signs of dementia. A lady named Susan, who's been part of our channel community for years, emailed me about how her normally cheerful husband suddenly became angry, forgetful, and distant over the course of a few weeks. At first, She thought maybe he was just going through a rough patch. But after some testing, they discovered he had a serious vitamin B12 deficiency. Once he started treatment, his mood and memory improved dramatically. That's why I always say, changes in how you feel mentally are just as important as physical symptoms. So as we continue this conversation, I hope you're starting to see a pattern here. These aren't just random symptoms. They're warning lights, signals. Your body's way of saying, I need attention. And I want to remind you again, this is not about fear. It's about power. The power of information. The power to act early. The power to stay in control of your health. Because you deserve that. All right, we've covered a lot so far. But there are still more surprising symptoms that seniors like you often overlook. And some of them might really surprise you. Now, let's keep going. I want to talk about another set of warning signs that often get brushed aside, especially as we get older. And honestly, this one is so common, yet so sneaky. Let's start with frequent urination, especially at night. It's easy to think, well, I'm just getting older. This is normal. And yes, to some degree, waking up once or twice at night isn't uncommon. But if you're getting up 3, 4, even 5 times a night, or suddenly rushing to the bathroom during the day, it could be a sign of something deeper. For men, it might signal an enlarged prostate. For women, it could mean a bladder infection or pelvic floor issues. But for both men and women, frequent urination, especially when it's accompanied by increased thirst, unexplained weight loss, or fatigue, could point to something more serious, like type 2 diabetes. I remember one viewer named Frank. He's 72. He emailed me and said, Marcus, I was up 6 times a night, drinking water constantly, and I didn't think much of it until my wife made me check my blood sugar. Turned out I was diabetic and didn't even know it. The truth is, your body always gives you hints, but it's up to us to notice them. Let's talk about another big one. Balance issues and frequent falls. How many times have you tripped or stumbled in the past few months? Do you find yourself reaching for walls or furniture just to steady yourself? Falls are not just accidents. They're warning signs. A decline in balance could mean problems with your inner ear, your muscles, your vision, or even early neurological issues like Parkinson's disease. One woman named Helen, she's 68, shared her story with our community. She said she fell twice in 1 week, both times blaming it on being clumsy. But when she mentioned it during a routine checkup, her doctor ran a few tests and discovered early signs of neuropathy linked to her diabetes. She's now doing physical therapy and balance exercises, and she hasn't fallen since. So please, don't wait for a serious injury to take balance problems seriously. And while we're on the topic of things we ignore, let's talk about changes in your voice or trouble swallowing. If you've noticed your voice becoming hoarser, weaker, or breathy, or you're having trouble swallowing certain foods, this could be more than just dryness or aging vocal cords. It could indicate issues with your throat muscles, acid reflux that's damaging your esophagus, or in more serious cases, early signs of throat cancer or neurological conditions, like Parkinson's. I had a subscriber named Bill, 71, who told me he kept clearing his throat for months. It drove his wife crazy. Finally, after she insisted, he went to see an end specialist. They found chronic acid reflux had been irritating his vocal cords for years. With medication and diet changes, his throat improved, but it was a reminder that small symptoms can sometimes be masking bigger issues. Now, here's something even more overlooked. Skin changes. When was the last time you really checked your skin? I mean, really looked? New moles, spots that bleed, sores that don't heal. These are all signals that something's not right. One of our longtime viewers, Nancy, wrote me saying she had this tiny scab on her arm that just wouldn't go away. It wasn't painful, wasn't itchy, just there. Turns out, it was a type of skin cancer called basal cell carcinoma. The good news is, it was caught early. But she admitted, if it weren't for a video like this reminding her to check, she might have ignored it for another year. And speaking of things on the outside, let's not forget about oral health. Bleeding gums, loose teeth, sores in your mouth that don't heal. These aren't just dental annoyances. They can signal infections, or even in rare cases, early signs of oral cancer. If you notice a metallic taste in your mouth or chronic bad breath that won't go away, it's worth mentioning to your doctor or dentist. Now, there's one last category of symptoms I want to highlight here, and it's the one that often feels the most subtle. Changes in appetite, losing your appetite for no clear reason, skipping meals, or suddenly finding food tastes bland or unappealing. Might seem harmless, but unexplained loss of appetite, especially when paired with weight loss or weakness, can signal infections, thyroid issues, digestive disorders, depression, or even cancer. A gentleman named Robert, a viewer of this channel, told me how he went from eating 3 full meals a day to barely finishing a bowl of soup. His doctor ran tests and found that he had a stomach ulcer that needed treatment. It could have turned into something much worse if he kept ignoring it. And here's something really important. You know your body better than anyone. If something feels off, even if you can't put your finger on it, don't talk yourself out of it. Don't let fear of making a fuss stop you from getting checked. I've had so many viewers tell me, Marcus, I wish I hadn't waited. And on this channel, Marcus Smart Channel, we always believe in this simple rule. It's better to get checked and find nothing than to ignore something and regret it later. Every time your body sends a new signal, whether it's physical, emotional, or mental, it's giving you a clue. And the sooner you listen, the more control you have. At the end of the day, this is about giving yourself the best chance at living well for many more years to come. Let's keep this conversation going. Before we wrap up today, I want to pause for a moment and speak from the heart. If you've been listening and quietly checking off some of these symptoms in your mind, maybe thinking, yeah, I've felt that, I've noticed that too, please, don't brush it aside any longer. I know how easy it is to downplay things, to tell yourself, oh, it's probably nothing, or it'll go away on its own. I've been there too. And I've heard this story from hundreds of viewers over the years. But here's the truth. Small symptoms often whisper before they start to scream. A little dizziness, unexplained weight loss, changes in your skin, your appetite, your mood. These are your body's way of waving a flag, asking for attention. And getting help early, catching things before they become serious. That's how we stay independent, mobile, happy, and here for more birthdays, more family dinners, more moments we don't want to miss. And hey, let me remind you again, this channel, Marcus Smart Channel, exists for exactly this reason. Every week, we talk about real issues for real people over 60. No fear-mongering, no complicated medical lectures. Just heart-to-heart conversations about health, wellness, and how to enjoy every year you've got ahead. So if you found even one thing helpful today, please hit that like button. Not just for me, but because it helps YouTube show this video to more people who might need to hear this right now. And if you haven't already, click subscribe. We're building a community here, a place where it's okay to talk about these things, where no question is too small. No fear is too silly. And I really want you to leave a comment below. Tell me, have you noticed any of these symptoms in yourself or someone you love? Have you ever delayed seeing a doctor only to wish later you hadn't? Or maybe you've had a health scare that turned out fine, and you want to encourage others here to listen to their bodies too? Your story might help someone else today. Also, if you want me to make another video diving deeper into one of these warning signs, whether it's about heart health, memory loss, digestion, or mental health, just let me know in the comments. This channel grows from what you tell me you need. And remember, the goal here isn't to make you scared. It's to empower you, because when you're informed, you're in control. You deserve to enjoy your 60s, 70s, 80s, and beyond with energy, joy, and peace of mind. So take that small step today. Make the call, book the checkup, start the conversation with your doctor. You're not being dramatic, you're being smart. And if no one's told you this today, you matter. Your health matters. And your story's not over yet. All right, that's it for today's video. Thanks for spending your time with me here on the Marcus Smart channel. Until next time, stay curious. Stay kind to yourself. And above all, stay well.